Yeah.
Okay, so some things, right? So come, standing up, come, or sit close where you can see. So we do this, nice, right? It's okay. A lot of times I'll give them.
Perfect.
And I just do a little general alignment and sideline. You know, upright, when they look at you in structural alignment, they use certain landmarks. The ear over the shoulder. Shoulder.
Sorry.
Shoulder over hip. And then hip over
Heel.
knee first.
Knee over.
And then heel. That's just some general alignment so that you know that they're stacked up and they can receive the pressure. So sideline, we're going to focus on the upper quadrant. Okay, so we're going to do shoulder, head, neck. But no, sideline, awesome for so many different things. Now we mentioned the pregnancy work, obviously. But if you're working on someone and say, in supine, adductor work can be challenging. Right? Sideline, not so much. Because look at, so supported, so open. Right? You can do so many different things that you can't do in supine or in sideline. Right? You can do sustained compression, you can do rolling, you can do myofascial, you can use your elbow to encourage length in the whole thing. So it's quite lovely for that. So you keep that in mind too. Also, hip work is great. I'm just giving it a little run of the mouth because we're not going to do so much. But right, you feel for the greater trochanter, the femur, and all this soft tissue here you can easily work into because the height is just so perfect for sustained compression. Right, so think about that if you want to include some sideline work with this. Look at the iliotibial band and the peroneals right here on the surface where you can come over to that side and do all sorts of compression and myofascial work.
Releasing the knees.
I'm sorry?
Is that good for releasing knees too?
Well, I mean, on the lateral side, because of the strong attachment of the IT band to the lateral portion of the knee, I would say. Yeah, and you know, I don't know exactly what you're referring to when you say releasing the knee.
Or just like, yes.
So it'll take some of the over tightness out of it. But remember, the IT band is there for structural purposes, and that if there's tightness there, like we were talking about, I would check tensor fasciae lata and upper fibers of gluteus medius if they're feeling reoccurring pain in the IT band, because that is a strong referral point down to the IT band. So you can work and work and work, which is good, but I would also include loosening those two areas for IT pain. And then just general hip loosening. That's one thing I started to do to sort of. And so I'm stabilizing, and then I'm taking, and back. See how that openness in the hip?
And the torso.
And our minds. You feel a little openness in it? That's very nice. Okay, now we can start up. It was like an infomercial for sideline. I'm quite fond of sideline. So here a little bit, yeah, you see. So I could come up on your shoulder a bit more, just to receive it. Okay, now you're here. So,
Can I ask something? Sometimes I think it helps if you put another layer underneath the top thigh. Does that help?
What?
Less thick.
That makes sense.
Try to do that for pregnant.
Okay, thank you. Okay, so now we're going to start by doing a little compression to the side of the head. Okay, don't do that very often, but you know, you think about how the bones in the head, when they interdigitate at the sutures, because of the overlying musculature, particularly on the side, it's the temporalis muscle, that big fan-shaped muscle, and then it comes and narrows, and it has a tendon that attaches to the upper portion of the ramus. So the temporal muscle has a lot to do with TMJ, right? it has a lot to do with just general tension in the jaw. So if you look at anatomy book again, it's sort of like a fan-shaped muscle, and the tendon comes right down in front of the tragus, this flap of the ear. So you can palpate the tendon there. But it lies in a shell of fossa on the side of the head, so it takes compression well. So you can come and just do palmar compression into the side of the head to not only loosen the muscle, but when you compress, it's like craniosacral work. When you compress into the sides of the head, it takes the bones towards the midline, and then you can let go, and it helps release it when you go into it and then release. So it allows the bones to expand a little bit at the suture. So compression into temporalis is very, very nice. It also addresses the beginning of the gallbladder meridian, our friend that we're finding popping up through the hip and the IT band and the peroneals and into the ankle. The meridian itself starts right at the outer canthus of the eye. This is the shape of the eye, the orbit where it narrows onto the side. That's called the canthus. So take your fingers and put them right on the canthus. And then move back about a finger width, and you'll feel an indentation. You press down into the center and do some circular friction. You feel that slight dull ache there? Yes? No?
Yes.
Okay, this is the beginning of the gallbladder meridian. And this is a very nice point. It's called gallbladder 1. And it's the beginning of gallbladder, but it's also called a clearing point because it helps open up your head a little bit, and takes a little pressure off of your eyes, gives you a little bit more opportunity to see things, hopefully a little clearer. So this is the beginning, and this is a very nice point to work on in head work and neck work. So coming here, compressing, and just follow this compression like a half moon shape behind the ear. And the heel of my hand is coming right up underneath the occipital ridge, so I'm going to stabilize here and place here just to get a little stretch in the posterior cervicals. Very nice, you can take your thumb and just place it right in gallbladder 21, gallbladder 20 rather, and just lean in slightly. You feel that point there? And you could easily, here's the mastoid process like I was talking about, and just behind it there is the indentation. So you can feel that it's a nice direct way to get gallbladder point. Okay. So from here, you have this, usually the neck is tight, shoulder is tight. So in sideline here, working from the head, you could take advantage of utilizing your body weight clear to open up this area. So you can just light pressure here, and then the palm of my hand goes over the head of the humerus. And I'm just going to extend my arms to get nice opening of the neck. You can see the... So nice way to use the body weight, just coming in. And after a little stretching, you want to try to find that other point that we were working at, gallbladder 21. And that's the one halfway between the base of the neck and the shoulder. And you want to direct the pressure down, and you should feel for some tightness. So you feel like I'm on the point now. So, like I was saying, the technique is only half of the deal. What elevates the quality of the technique is all that's happening behind here, meaning you as the therapist. So just try to stay focused on what you're doing and to get your body in a line so that there's not a lot of wasted motion or resistance against your body weight transferring into that person. That your body itself, you're utilizing it so it's comfortable. So you're not straining just to do something good for another person. You want to take care of yourself first. Because that's what elevates the work. So the technique, pressing here, lovely, that's half of the deal. Everything else is a you. How your mind is about the work, how you're contacting the person. Because if you're just there, then you feel everything more readily. Okay, so say here, still super tight, you want to do a little sustained pressure. You can, from here, which you can do sustained pressure like this, I would do a supported thumb but more than that, I'll use my forearm because it comes right in. So I'm stimulating with this side, but then I'm going to do forearm here. And it's just light pressure here, and I'm going to come in and just lean in with my forearm. Is that pressure okay? Because it's nice broad, and again, I'm not pushing, I'm using my body. So I'm lining up behind here so that my weight comes through. Easy. And then again, like I said, you know, any things you want to do that you already know to do here, you know, scaling work is easy to do here. SCM work, easy to do here. But I'm just going to keep it general. You all know different things. So, started with compression, gallbladder 20, compression, gallbladder 21. And now I'm going to come up on the table. So I'm going to bend here. One knee comes up supporting her. And my knee is about even with the top of the shoulder. And I cite that as a criteria because that puts your body in good position for doing some things like this. So you can come underneath here like this, and now you have control of the shoulder girdle. So one thing you can do is intertwine your, thank you for the video, the lighting. Intertwining your hand like this, and then just using your body weight, we're just going to lean back to get some nice motion in the shoulder girdle. So you get lovely stretch. Just body weight, right? And if the head starts coming up, and this is important to have below to try to keep the spine neutral. Right. So when you're doing this, you see the head coming up a little bit. That tells you that there's still some tightness in the neck. Right. So you just sustain, and then you can change the angle a little bit. And then you're just going to let your hands separate so that you have nice control of the shoulder girdle front and back. And we're just going to do some range of motion. So nice full range of motion. So you let your weight come down so you have slight depression of the shoulder when you move in your body. And nice full motion one way and the other. So on most people you can do this now. So come home. So what we're trying to do is get up underneath the vertebral border of the scapula. So for that, if you let your shoulder fall forward more, so that this is more pronounced. So here, not so pronounced. Here, when you let it fall forward, it easy to get at. So I'm going to use my leg as a support and take my hand and rest. That's going to be resting on my thigh, so it's not up in the air. But what I'm going to do is feel first for the vertebral border of the scapula, and then I'm going to hook my fingers up underneath there, the pads of my fingers, and then I'm going to bring it back on there, and then I'm just going to lean back to the side. So you're getting a nice lift of the scapula off of the back because it gets glued down. So you want to come underneath, and then you want to bring it onto your pads of your fingers. So you put it there, and then you mobilize the shoulder girdle right back on your fingertips. And once you're underneath there, you just let your weight go to the side. And you get some nice digital compression. And you take it down to the inferior angle. And you can do a couple times. You know, not everybody you're going to get underneath there, quite frankly. But if you can't get it underneath there, you put it like this, and then you can just do digital compression. That's the beauty about having them turn onto a pillow. So you can get all this motion up here by just simply compressing. Right? You can't do that in prone. Right? But you can in this because you can get nice motion because they can turn onto the pillow. So you can do a lot of nice back loosening. But as far as addressing primarily the rhomboid attachment on the vertebral border of the scapula, if you want to, digital compression this way, quite nice. Okay, so then after that loosening, we want to do a little counter stretch. No, come on. This is the best part. Is so we did here, we did here, so we should do a little something here. So working Pec Major and Pec Minor. So a couple of things. You can bring the arm like this, right, and then braced fingers. You can do a little circular friction up here first, just to loosen. Yeah, this arm position opens this area up. Right, so brace fingers. And you want to pay attention to where you're at. So here's the clavicle. So I'm just distal of the clavicle on the inside of the humerus and only going down about this far. So you're thinking about Pec Major, not breast tissue. Right? So here. And if you know those bony landmarks, ladies probably get a pass if you do breast tissue. I don't. So I'm very conscious about what I'm doing, as I should be, just out of respect, if nothing else. So I like loosening. Now, loosening is one thing. Let's see, maybe like this. This is Pec Major. Right? So my thumb is coming underneath it, my fingers are on the top. And then you can just lean back and do a little roll and loosen on Pec Major. That's okay. Looking under, rolling it out. This is something you might want to do for a really tight Pec Major. And Pec Minor is underneath Pec Major. So if you come closer so you can see. Here's Pec Major, see? Yes? Yep. You're going to come underneath there. So to get Pec Minor, when you go down, you feel the ribs. These are the ribs here. You keep sliding medially until you bump into the muscle. That's the lateral border of Pec Minor. It's the easiest way to get at it from sideline position. So here's Pec Major. You come right below it and you press straight down and you'll feel the ribs. And now you follow the ribs. It's like you're following the ribs right up to the lateral border of Pec Minor. You'll get it every time. And you can do just digital compression into the side of Pec Minor to help release it. Or else you can do digital compression and do pin and stretch. You feel? I was going to say nasty, but that's good. That's good for it. It's just, again, a muscle that doesn't get worked on directly like this a lot, and that can make a big difference in the overlying structure to help release. This supported position also too, so I'm just going to turn this way and go right down into it. You feel that engagement there? This is a very easy way of getting Pec Minor, and maybe it doesn't feel as intrusive for the person. This is something you consider too, but not too much. So like this, so her arm is resting on my hand, and I'm just rolling right into it, so the pads of my fingers going right into Pec Minor. And like I said, if you want to do pin and stretch, you simply bring the arm home. So that's some nice things for that. And then just going to end with a stretch of Pec Minor. So since we just worked on it, and remember Pec Minor has a 45-degree angle attachment to the coracoid process, so it's rather at this angle. So when you do a stretch for that muscle, you want the arm to replicate that angle. So you want it to be at this position and then back. That's Pec Minor stretch. Because if it's down too low or up too high, you're stretching Pec Major. Okay, so you want to come. So usually I'll bring straight up and then forward a little bit and then back. That's Pec Minor. And if you're working on someone who could really use, if I work on a couple of power lifters, guys, sweet, both guys, so nice. But dudes are like this. Brandon. What do you want me to do with that? But so they can't. Their arms are like my legs. I can't do this stretch, but I started doing this, which is nice, and a lot of people like it. So this is Pec Minor still. Hand behind here, stabilize here, back like this.
Mm.
That's nice temporalis stretch. Okay. Okay. So I've learned we end on the ooh. So end the video.
Ooh, ah.